Please just lie there and relax. I'll be with you in just a second. So, it looks like this is a case of horizontal double vision. Okay, and you're seeing two images side by side. Okay. And the double vision has been present for 2 weeks. Okay. Has it increased in that 2 weeks, or remained the same, or improved? Okay. Have you experienced any trauma to the head? Any physical trauma? No? Trauma. And has anything like this ever happened before? So this is the first time. No trauma. How is your health at the moment? Any health conditions such as diabetes, hypertension? Do you wear spectacles? Okay. And do you take any medication? Any medication? Okay, so it is horizontal diplopia for 2 weeks duration. Health-wise fine. No medication. Okay, let me take some measurements as you're just relaxing there. Into this eye. Looking into this eye. Good. Looking into this eye. Let me go on this eye now. Any history of eye problems in the family? Okay, glaucoma, macular degeneration, cataracts. Okay. Just looking into my eye that I'm pointing to here. And over to this one. Check along the scale there. Okay, just looking straight ahead. I'll just check. Right pupil. Left pupil. Okay. Sorry about the bright light. These are important tests to perform. Just swing the light right to left. Looking straight. Just looking up to the ceiling, looking to your right hand side and looking to the left. Okay, looking down again, if I could just lift the lid. And down again. Okay, so a perfectly white conjunctiva. All zones, right eye and left, grade 0. Okay, and can you definitely see 2 images here? Okay, just follow one of the images for me. Pick an image and just follow. Good. Switch targets. Okay. Just looking in the centre of the bow tie, the teddy bear please. And is the image still double there? Okay. And are you seeing double there? And just a bit further back. Is the double vision present? Okay. Do you see more double vision here? Or more double vision further back? So closer is more single, but here it's more double. Okay. Just locate the mouse for me and just follow the mouse with your eyes, keeping your head steady. Okay, do we have double along the horizontal there? There. Okay, single there, double there. Okay, just continue following one of the mice, please. Or just follow whichever image you feel is the real one. Good. Looking into my left eye there. We just need to take these measurements. Okay, so I need to make a referral. Just looking up for me now. Keep looking up. Okay, good job. Keep looking up for me. Some green light now. Okay, just looking up and right. Up and left. Now directly to the left hand side, please. And to the right side. Looking straight down again. Okay, now just look down and right. And down and left. Just looking at the light. If you have double, just pick the image that looks like the actual image. Just follow the light with your eyes, keeping your head steady. Just do a motility test. Okay. Just rest this on the bridge of your nose there. Just looking towards this eye best you can. Take a scale measurement. Okay, good. Okay, so moving further back here. Just tell me how many fingers I'm holding up there. And how many there. And there. Okay. And finally with the right eye. Okay, cover your right eye now. Looking through the left. Okay. Just looking at the reduced Snellen chart here. Looking at the top row, are you seeing any double vision there? Okay, and on this row, just have a go at reading the letters even if they're doubled. And this row, please. And this row. And can you manage this row here? And find the near print of N18. Just read what you can on this row. And the next row. This row. And this. And N8. Good. And N6. Second row down, please. And finally N5. Can you read any letters on these rows? Okay. So I'll just record these results. Externally 25-degree double vision. I'll just move the laptop over here. Now we're just going to try some lenses purely for visual clarity improvement. So, have your last prescription on record here. Okay, just looking towards me, and I'll show you some lenses. Just see if my face is cleared with or without the lens. Okay, this with and without. Am I cleared with or without? And the next lens, do I look clearer with or without? With or without? Good job. This is with and this is without. I think it's clearer with or clearer without. Excellent. Okay, just cover your left eye for me now. And the previous prescription. The right eye. Okay, and again. Just using the right eye here. Things clearer with or clearer without. It's with and this is without. Okay, final lens for the right eye. Sharper with or sharper without. Am I sharper with or without? Okay. Okay. Cover the other eye now for me, please. I'll just try these lenses again. Are things clearer with or without? Clearer with or without? Okay, one more lens. This is with and this is without. With or without. Okay, moving on, we're going to try presenting some prism lenses in front of you to try and eliminate the double vision. So let me know if things remain double with the prism. We still have horizontal double there, is that correct? Okay, let's try a stronger prism here. Okay, so we have base out there for the intern. Still double. Okay, and we'll go up in strength here. double here? Okay, so we still have double with and without this prism. Okay, let's increase the strength further. Okay, I think still double here. Okay, is the double the same as it is without? Same separation. Okay, let's just record those results. Double. Prism diopters. Prism diopters. Separation. And without. Are you experiencing any pain with this double vision? Any pain, or is it painless? Painless. Absence of conjunctival redness. Grade 0 limbal redness. Limbal redness, grade 0. Let's just confirm the results. So we're going to use some more lighting. Just look straight through the illuminating device, please. And I'm going to check the cornea now for any abnormalities. Are there any abnormalities arising on the cornea? The right eye, it appears negative. Okay, keep looking straight so I can observe the left eye cornea. Okay, take a blink, and again. Great. Right, so we need to go further now. We should have a look inside the eye to check on the ocular health, just to ensure there's no ocular pathology. I'm going to use the tried and trusted ophthalmoscope for now. So I'll just set this up. It's a very intricate device. I need to ensure we have the right settings for optimal viewing. And it makes lots of sounds as well. I need the right aperture, the right power, and the right filter. So it looks like we are good to go. I'll use a lower illumination to start with. Keep looking straight ahead. Take a blink. Blink again. Okay, crystalline lens is clear. Crystalline lens. Let's go further and look at the back of the eye now. Through the vitreous humour, onto the optic nerve. And you have a good optic nerve there. Good. Okay, looking up, looking left, looking right, now open right, and open left, down and right, down and left, and straight down to the floor, keeping that still. Good. up, looking right, looking left, and down. Okay, switch the aperture and the filter. Looking straight, blink normally please. Looking up, looking right, looking left, and looking up and right, and up and left, and down and right, and down and left, and straight down to the floor. Okay, the back of the eyes look clear. There's no signs of any pathology whatsoever, externally or internally. So let's just record those results down. So ocular health. Cornea. Lens. Clear. Optic nerve head appearance. Smooth, even caliber blood vessels. Maybe ratio 2 to 3. The macular appearance. It appears flat and clear. And finally, after looking at the blood vessels, fundus appearance and the external retina. Clear. Absence of pathology. No hemorrhaging. No retinal tears or detachments, but I am going to dilate your pupils for another assessment. Okay, so let's put a little drop into the eyes here. So I'm going to dilate your pupils, leave you dilating for 20 minutes, and then we'll have another look at the back of the eyes. Okay. Looking up to the ceiling for me, and we'll pop a drop in the right eye, and a drop in the left eye there. Good. Okay, just take a few blinks. The stinging will soon wear off, and I think it's high time I started drafting up a referral for you to be seen at the eye hospital by an ophthalmologist, and eye doctor. How are your eyes feeling? Okay, if you could make your way to the reception area where you originally was, and I will call you back through in approximately 20 minutes. Approximately 20 minutes. Thank you.